Welcome to Diabetes Health TV. We have a really special guest in our studio today, Cesar Yaro. Welcome to the show. I am so glad to have you here. Cesar's my hero. He's had diabetes for about 18 years, and about 10 years ago he started reading our magazine. And what he does, all volunteer, is he comes by our office regularly, picks up a box of magazines, and then he, all volunteer, drives them all over the Bay Area, delivering 5 or 15 copies to doctors' offices and diabetes clinics that he knows about. And I so appreciate this. He's just been doing such a great job helping Diabetes Health magazine grow. And he dropped by the office today and we started talking, and Cesar has some amazing things to say about his diabetes. And tell us some of the diabetes complications you've been challenged by. I know your eyes.
Yeah, I've had bleeding in my eyes, and I had to have a vitrectomy at a hospital a couple months ago. Mm-hmm. So right now I can only see through one eye, and I'm supposed to have a vitrectomy in my other eye in a couple of weeks. Because the diabetes, it makes the blood vessels in the back of your eye bleed. If you have a high blood sugar and high blood pressure.
Mm-hmm. Anything else? Any other complications? Neuropathy?
Neuropathy. I've had neuropathy in my toes. Mm-hmm. And I had surgery done on those a couple years ago. So I kind of limp a little bit.
Mm-hmm. You're telling us about the dialysis, that you go in 3 times a week for dialysis, and that you really need 4 treatments a week. So tell us about that.
Well, ideally you should go in for like every other day for dialysis treatments, but I heard that Medicare will only pay for 3 days a week. And
so with the 3 days a week, you're not really getting your blood as filtered as it ought to be?
Well, yes.
And how much does that cost?
Well, the Mills Peninsula Hospital dialysis unit I go to in San Mateo is $12.50 for 4 hours every time I go in, which is over $15,000 a month.
$15,000 a month.
That Medicare and my other insurance, Blue Shield, pays for.
Mm-hmm. And you're saying that's really not enough. That's just the maximum they allow in numbers of treatments.
Yes.
Now tell me, you mentioned that there's an alternative, home dialysis.
Well, you can do peritoneal dialysis, or you can do a blood dialysis at home, mm-hmm. using rented equipment. Mm-hmm. But you need a nurse or attendant to come in to help you do that. But Medicare will not pay for the nurse or attendant, which is like roughly around $200-300 every time they come in.
So would it be cheaper, do you think? The government would pay less money if you did home dialysis?
Yeah, I think it would be cheaper in the long run for them to pay for the home dialysis, to pay for the attendant to come in.
Mm-hmm. So when you got diabetes and you started taking care of yourself, did you know these complications were possible?
I knew it was possible, but I really didn't think I would actually get them.
Across the country, diabetes educators are losing their jobs because diabetes education doesn't make a profit for the hospitals and health insurance companies. Do you feel like you're getting enough diabetes education?
No, not really. Unless my doctor suggests that I go to a school at the hospital to learn about diabetes education, then that's the only way I would know about the education.
Mm-hmm. You know what, there's this common problem that this society has, is they blame the diabetic. I often hear people say, Yeah, my aunt, she never took care of herself. And it's like, it puts all the problem on the person when actually this person maybe didn't have it said properly to them, didn't get the education, didn't know how to take care of themselves. Do you think you might be in that category?
Yes.
Yeah,
Yes.
I would think so. That 80% of complications are preventable with education. And unfortunately, we have a system right now that doesn't pay healthcare professionals to educate. It pays them to do procedures like surgeries and vitrectomies, but the education that might have prevented those isn't being paid for. And I'm really sorry. I'm really sorry the system's like that, and we'd like to change it.